It's 6:37 right now. COVID cases continue to creep up around the 5 boroughs, and the BA2 subvariant accounts for a majority of all new infections, especially in Manhattan. Meanwhile, Mayor Eric Adams is recovering from his positive COVID diagnosis. He spent his 100th day in office in quarantine. Now, despite the uptick in cases, Mayor Adams promises New Yorkers the city is moving past this virus. Fix 11's Rebecca Solomon is live in the newsroom with more on where the city stands on battling COVID. Good morning, Rebecca.
Hazel, good morning. More than 2 years into the coronavirus pandemic, some of the nation's largest cities are reinstating mandates to keep people safer. Philadelphia just announced people must mask up once again following a sharp increase in reported infections. Here in New York City, leaders are avoiding any return to restrictions and instead relying on the public to get vaccinated.
Booster vaccination. That could be the difference between hospitalization and possibly even worse. I want to encourage every New Yorker to get booster and get vaccinated.
A raspy-voiced Mayor Eric Adams addressing New Yorkers from quarantine, crediting his mild symptoms to his COVID-19 shots. The mayor joins a growing list of high-profile officials testing positive for the illness. Health officials say BA2 is to blame for the current uptick at a time when New York's restrictive COVID mandates have been lifted and more people are flocking to the Big Apple, boosting area businesses.
It's getting warm out. The jump we've seen this spring has definitely been sizable in the sense that it's really people coming back to the city.
Mayor Adams wants to keep the momentum going despite the latest city data, which shows daily average increases for both the number of people testing positive and the total number of confirmed and probable cases. Cases are still well below the recent Omicron winter peak in January, and the mayor says right now there's no reason for a return to a mask mandate.
Well, it's a combination of things we're looking at. We're looking at the infection rates, as well as hospitalization, as well as deaths, and how fast the case is spreading. The doctors have created what scenario will cause us to move to the next level. We're not there yet, and when we do, we will announce it.
New Yorkers we spoke with say they trust the city is keeping up with science.
I hope that we do whatever the public health officials tell us to do.
New York knows how to do it, and we'll do what needs to be done.
Governor Hochul says it's even more important now to stay up to date on vaccine doses and to get tested before you travel ahead of the spring holidays, which are quickly approaching, to help limit the spread of the virus. Live in the newsroom, I'm Rebecca Solomon, Pix 11 News.